Hello, everyone. Welcome to our final day of ANH Academy 2022. My name is Elena Martinez, and I'm the technical manager for this session. I'm very pleased to welcome you to this side event on food environments of deprived urban neighborhoods in low and middle income countries. Thank you so much for taking part in our conference. I want to remind you that you can find the conference materials and program as well as details about this session on our website at anh2022. So thank you so much. Welcome, and I will pass this to Romana Iqbal of Aga Khan University to get our session started.
Thank you, Elena, and hello, everyone. It's so good to have you all over here with us to discuss something which is very relevant and important, and that is food environment of deprived urban neighborhoods, often what we refer to also as slums in low and middle income countries. I'm Romana Iqbal. I work at the Aga Khan University in Pakistan. And we are doing this, side event in collaboration with colleagues at Warwick University. Dr. Oyinlola Oyeboide is working at the University of Warwick, and we have a long-standing association with her, and also with Sarah, and Amar Khan works with me. So this is a picture of, the setting, one of the deprived urban neighborhoods or slums, where we have been working, and we'll be sharing some data that we collected in this setting with you shortly. So I just thought I'd go over the program with you. So my task over here is to really introduce the session to you, share objectives, and then we'll go around and have a round of introductions. And then I'll be requesting our colleagues who are here with us to talk about some of the projects that we have done in deprived urban neighborhood settings. And then we'll have discussion on these projects that we have done. And then I'll hand over the screen and the mic to my very worthy colleague, Dr. Oyinlola Oyeboide, to chair and talk about next steps, which is actually, if you ask me, one of the very important purposes and main reasons as to why we are meeting here today. So very quickly speaking, we know that research has been done on deprived urban neighborhoods, and there is some data on low and middle income countries, slums or DUNs as well. However, most of it has focused on infections and maternal and child health issues. But we do understand now, and there's considerable evidence to say that non-communicable diseases are rising in deprived urban neighborhoods as well. And that's actually has been our main interest and focus of the work that we have done thus far. And the idea really of coming together, is to understand and improve the food environment of these deprived urban neighborhoods. And I wish I had, but I haven't, underlined the word collaboratively over here. And hence this meeting today, we want to work with you. We want to have more partners. And the specific objectives really of our meeting today are two. One, the first set is around advocating and sharing what we have found in our work, but then to also learn from you as to what your findings have been in this space. And then, as I said, the other set of objectives here is kind of more futuristic and more important, and that is how do we work together collaboratively, write grants and other stuff, and also perhaps form a specialist interest group and work together in the future. So I'll stop here. I know there'll be time for questions and answers, and I'll move to the next piece, which is a round of introductions. And I'm just looking at names on my screen, and we'll just go around in that order. So the first name on my right is Sarah. Sarah, would you like to introduce yourself, please?
Sure. Thank you, Dr. Romana. So my name is Sara Querol. I have recently finished my PhD at the University of Warwick And my interests lie on topics like adolescent health, participatory research, action methods, and food systems.
Thank you, Sarah. So I'll go to the next person on my screen, and that's Amber Khan.
Hi, good morning, good afternoon, everyone. I'm Amber Khan. I am a nutritional epidemiologist. I'm working with Dr. Romana Iqbal in Khan University, Karachi, Pakistan. So my interest is dietary data collections and food systems, understanding food systems in Pakistan. Thank you.
Thanks. Next person on my screen is Kate. Kate, would you like to introduce yourself?
Hello, everyone. I'm Kate Schneider from Johns Hopkins. My interests are around equity and access to healthy foods.
Thank you, and thanks for being with us. Irene Indulai.
Good morning, good afternoon, wherever you are. My name is Irene Induli from the Alliance of Biodiversity International in SEAT. I work as a research fellow with a focus on nutrition-sensitive agriculture. Thank you.
Thank you. Thanks. Next person here is Myra Mubashir.
Good morning, good afternoon, everyone. I'm Myra, and I'm a nutritionist by training. I'm currently working with Dr. Romana Iqbal at Khan University as a research associate in a school-based project. Thank you.
Thank you. Next, we have Dr. Sheila Krishna Swami.
Hi, everyone. I'm Sheila, and I must thank Romana for sending the details of this program and the link to us. I'm from India, and I'm an independent consultant, nutrition and wellness consultant in India. And I'm here to learn, listen and learn from all of you. Thank you.
Thank you. Thank you for being with us, Sheila. Next, Emma Walton.
She's unable to speak, so she's put her introduction in the chat. She said that she is Emma Walton. She's a research assistant at Imana LSHTM based in London, and that her interests are equity and challenges to realising the right to food and linking citizen engagement with policy action. And then we've got Remco Peters next, who's also unable to speak at the moment. He's a research associate at the University of Bristol. With his PhD research, he was interested in better understanding rural to urban migrants' perceptions of their new food environment in Duns in Nairobi. Oh, so we've got something very interesting to talk to you about later. And he's also interested in the right to food and qualitative participatory approaches.
Welcome, Emma, and welcome, Remco. And thank you, Lola, for reading out their introductions. And I'll turn to you for your introduction now.
Hi, I'm Oyanola Oyabode, known as Lola. I'm an associate professor in public health at University of Warwick, although I'm moving to be a professor in public health at Queen Mary University of London in September.
Thank you, Lola. Next, and Lola is the main contact person for this event. Next on my screen, I have Kafayat Adebayo.
Hello, everyone. I'm Kafayat Adebayo from Federal Ministry of Health, Department of Public Health, Nigeria. I'm doing my PhD on adolescent health in secondary school. My research interest is food safety, public health among adolescents. It's nice to be here. I plan to learn, I collaborate with others on issues relating to the adolescents. Thank you.
Thank you and welcome, Kafayat. Next, I have Izatao Halu. I guess that's how I have to pronounce this name.
Oh, hi. I didn't realize I was supposed to introduce myself. My name is Aissatou Jallow. I'm a nutritionist from the Gambia.
Very good and welcome. I have Anna Vanderkoy.
I'm Anna Vanderkoy and I work with Helen Keller International. I'm based in Senegal and currently working on a research project on consumption among young children in Dakar, especially unhealthy commercial foods or snacks. So this, I'm really excited for this session. I'm interested in food systems and food environments, and especially with linkages to agriculture and nutrition, especially young child nutrition.
Thank you and welcome. And the last person here on my screen is Emily Fibian.
Hi, I'm Emily. I am a research assistant at London School of Hygiene and Tropical Medicine. And yeah.
Thank you for being with us, Emily. Thank you all. Helen, are you able to unmute your mic and introduce yourself? Yes, there you go.
Hi, yeah, sorry, I was having some connection issues. Happy to be here. I'm Helen Harris-Fry. I'm an assistant professor of nutrition at the London School of Hygiene and Tropical Medicine. I'm really interested in this session. I've got a doctoral student that's about to start some work in this area. So I'm really excited to hear more and learn from others in this session.
Thank you for being with us, Helen. And
there are two more people who've joined. I don't know if you've noticed, Himanshi and Giacomo.
Yes, I just saw one. Thank you, Lola. So Giacomo Zanello, would you like to introduce yourself, please?
Hi, everyone. Good morning, good afternoon. My name is Giacomo, and I'm an economist by training and work at the University of Reading in the UK. So thank you.
Thank you for being with us. Economists working in the area of nutrition are very few and hard to find. So thank you for being with us. So now let's talk about food insecurity in 7 slums across 4 countries. This is work that Lola led. And so over to you, Lola.
So yes, I'm going to talk about food insecurity in 7 slums across 4 countries, which is work that was done by an MPH student at Imperial, Clara Speaker, who couldn't be here today. So an estimated 1 billion people live in slums, which are very deprived urban neighbourhoods with poor quality housing and lack of infrastructure. The term slum is pejorative in some countries and some regions of the world, and Romana and I didn't use it in the title of the session for this reason, but the UN does continue to use the word slum, and many people who are living in slums themselves also use the word. And today, this work that I'm presenting is secondary analysis of data that was collected by a global health research unit focused on slum health. So that's why I'm using the word slum in this presentation. So this project, this larger project, was the NIHR-funded Global Health Research Unit on Improving Health in Slums. And we included collaborators from University of Ibadan in Nigeria, APHRC in Kenya, Independent University of Bangladesh, as well as Warwick and Aga Khan. So Romana, here she is, she was the lead for Aga Khan University, and I led work package 2, which was a household survey. And that's the data that I'm presenting today. So the household survey actually focused on health service use, but because of our interest, Romana and my interest in diet-related ill health, I was seeking ways to use the data to understand those things. And we had included this question. So as part of the household survey, we included the DHS module that helps to assign socioeconomic status to households. And that module includes this question, which was, in the past 7 days, were there any days that the household did not have enough food or money to buy food? So that evaluates some dimensions of food security. And we know that food insecurity is associated with poor quality diet, obesity, diabetes, and cardiometabolic disease. So we thought this was a good place to start. And we started by wanting to look at which factors were associated with food insecurity in these sites. And so the factors that we looked at, the independent variables based on findings, we based on findings from the published literature and also what was available in our data. So we looked at household head characteristics, their education, employment, migration status, their age and sex. We looked at the household size. So we looked at the household size as well as the number of children under 12 in the household and the proportion of adult female household members. Then we looked at wealth quintile, and also because these questions come as part of that DHS module, so we could also look at whether the household owned a fridge, whether they had a separate kitchen, so a room that was used specifically for cooking, and also whether they had agricultural land. So just to sort of show you the distribution of a few of those variables, which I think are really relevant to the food environment. So, well, we've got the sample sizes across the top, and we only included households where they had a household head. So just in case you're thinking that you'd like to do other secondary analyses of these data, the sample size is slightly bigger when you include all the households. But when we looked at which houses had a separate kitchen, so a room for cooking, you can see that it's really very low in Kenya. In the Kenyan sites, less than 7% had a kitchen, but much, much higher in Pakistan. And I think straight away, this is really interesting when you're thinking about the resources that the households have to prepare healthy food for themselves, and what that means in terms of them, people being more likely to buy ready-to-eat food on the street, for example. And then we also have this variable about the refrigerator, and again, very, very low in Kenya and much higher in Pakistan, for example. But look how low it is in Bangladesh. Only 9 of the households had a refrigerator. And again, this is telling us about whether they owned a refrigerator, but we know that electricity isn't always reliable. So they may possess a refrigerator that can't be used, and we don't get to that with this data. Then our major outcome of this research, which was the household food insecurity, again, very high. So in the total, you can see 40%, over 40% of households were food insecure. And again, you can see the large variation. So from Bangladesh with less than 10%, up to nearly 70% in one of the Nigerian sites. And finally, this possession of agricultural land, which again varies a lot, so very low in Pakistan, and here highest in Bangladesh, where more than 70% said that those households in the urban slum also possessed some agricultural land. In terms of the results then, there are some things I think we would probably all predict. So household heads' employment status, the household's wealth quintile, and whether or not they owned a refrigerator, all of those things were consistently associated with food security in the pooled analysis. So we did a pooled analysis where we also adjusted for site, and then we also ran the same models for the individual sites, and we found consistently that these things. So if the household head is employed, the household is less likely to be food insecure, and the wealthier they are, the less likely they are to be food insecure. And if they own a refrigerator, they're less likely to be food insecure. So I think that's what you'd expect. Then we also found in the pooled analysis and several of the individual sites that ownership of agricultural land was associated with food security. So if they owned agricultural land, less likely to be food insecure. But that was the opposite in one Nairobi site where there was a significant association in the opposite direction, so increased food insecurity in the houses with agricultural land. So I thought that was very interesting, and trying to work out what the reasons might be for that particular site, this ownership of agricultural land, which seems to be a buffer for other places not being. I mean, was it to do with weather conditions? You know, it's interesting to think about why that might have been different. And then finally, we've got the migration status of the household head. So that's what I was thinking when I saw the person who said he was interested in migration. So it wasn't significant in the pooled analysis, but in one Nigerian site, there seemed to be about 3 times greater risk of food insecurity for the people who had always lived in the slum compared to the migrants into the slum. So again, that's sort of counterintuitive. You might think that the people who had migrated into the slum would have fewer resources and less social capital, and so would be more likely to be food insecure. But in this case, it was the people who had always lived there who had the greater risk of food insecurity. And so the conclusions from this work are that there's a high prevalence of food insecurity in slums, and particularly in the Nigerian sites we saw, that economic factors were important determinants of food insecurity. And finally, that migration status and agricultural land, ownership of agricultural land, showed varying effects across different slum sites, even different slum sites from the same city, which I think is quite an interesting finding. So that's the end of my presentation. Thank you very much for listening, and I'll hand back to Romana.
Thank you, Lola, and we'll take questions after our 3 presentations. So you can write your questions in the chat box, or we'll be inviting you for questions later on as well. So moving to the next presenter, may I now request Sarah to talk about her work that she did in an urban slum setting.
Yeah, hello everyone. Thanks for giving me the opportunity to speak in this conference and participate in this side event. My thesis explored malnutrition in South Asian adolescents, and today I'll be presenting my qualitative research project, which is based in slum in the city of Karachi in Pakistan. As you know, malnutrition is a highly prevalent and persistent health issue in low middle income countries, and its harmful and long-term consequences come at a high human and economic cost. But the good news is that adolescence presents a second window of opportunity to catch up with growth, shape health behaviors, and stop malnutrition in the next generation. We know that children living in slums are at high risk of malnutrition, However, there is limited knowledge of adolescents living in slums. So the aims of this study were to explore awareness and perceptions of malnutrition among adolescents living in a deprived urban neighborhood in Pakistan. We recruited 14 school adolescents, 5 boys and 9 girls, aged 13 to 16 years old, in a slum in the city of Karachi. Malnutrition has been usually measured quantitatively, so research has focused on calculating prevalence and associations. However, this research project uses photo diaries and interviews to address malnutrition in slum areas. Participants were asked to record their thoughts about malnutrition in photo diaries and take some pictures with a Polaroid camera. We also used interviews to complement photo diaries data. This study is exploratory in nature and used an inductive strategy that moved from open-ended data to patterns using reflective thematic analysis. Moving into the results and interpretation, here you can see the 3 themes from the analysis. The first theme describes the role of good or bad food in health and nutrition status. The second theme focused on participants' social context influences concerning their dietary intake and food choices. The third theme explored participants' preconceptions of being healthy. So in the first theme, we identified a pronounced dichotomy between the good and the bad. Food and lifestyle choices were regarded as either good or bad, with no middle ground. So perhaps this polarized reasoning reflects an emphasis from their community and household living environment to eat healthy food, to grow and be in good health. Food consistently underpinned participants' narratives and photo diaries. They focused on snapping pictures of good and bad items. So they suggest that their understandings of malnutrition were in some way limited to the relationship between food and malnutrition. This also revealed how they made sense of malnutrition. So for our participants, undernutrition was a lack of food and overnutrition was an excess of food. This photo diary project was recognized as a learning experience that empowered participants to learn or keep learning about nutrition. Moving into the theme number 2, parents and siblings participated in this photo diary project. Siblings appeared to help more with making the photo diary, and parents seemed to provide the nutritional knowledge. Participants seemed to internalize this knowledge and incorporate it into their own narratives. Kira, for example, said that my mother told me that eating tomatoes cures anemia. Friends also appear to influence participants' food choices greatly. David mentions in his photo diary the unwanted weight gain from snacking with friends. Participants mentioned that friends insisted on eating junk food and smoking cigarettes, making apparent the peer pressure. The harms of eating out versus the benefits of eating homemade food were mentioned by several participants. Sunny, for instance, says, food from outside makes us sick, but if we eat homemade food, it will give us nutrition. That means energy. Moving into theme number 3, we found that the majority of participants identify someone around them overweight, thin, or anemic, but they didn't comment on their own nutritional status. Participants were aware that thin or fat bodies were not well regarded, as thin people want to put on weight to look as good as others, according to Salman, and overweight people get sick and do not look good, according to Saina. This probably explains why participants tended to see themselves as healthy and clearly separate themselves from the unhealthy others. All participants indicated numerous pieces of advice to be healthy like them: tobacco, smokeless tobacco, fried food, street food, soft drinks, and bad influences should be certainly avoided. They suggested doing exercise and eating fruits and veg. Participants also gave some hygiene recommendations, as you can see from Solman's photo diary. Participants considered that nutrition and health are in our own hands, and Dreams said undernutrition or overnutrition is caused by human itself. People should take care of their food. People's responsibility to eat healthy was highlighted by our participants, implying that the others are the ones to be blamed for their poor lifestyle choices. Following this responsibility discourse, most participants contemplated merely individual-focused health interventions in order to overcome the problem of malnutrition in their area. For instance, they suggested providing health information and food donations. Finally, as the main takeaways from this project, we identified malnutrition awareness among these adolescents. Malnutrition appeared to be strongly linked to dietary intake and eating habits. Malnutrition was understood as a lack or excess of food. We argue that given the attractive and engaging nature of this method, it can be used to explore health-related topics among adolescents and empower these populations. Adolescents have the ability not only to participate in research, but to generate insightful data. And it is necessary to better study Islam environments to implement effective nutrition programs and upstream interventions to reduce malnutrition in Islam settings. I would like to thank all the supporting team and thank you very much for listening to my presentation.
Thank you, Sarah. Thank you. We'll now move to the last presentation of our session by Ms. Amber Khan, which is on exploration of the food environment in Azam Basti. Amber, over to you.
Thank you, Dr. Romana. Hi, good morning, good afternoon, everyone. Today I'm going to present this work as a part of the Urban Slum project that Dr. Lola has already presented. So the study name is Understanding the Role of Food Vendors in Creating Healthy Food Environment in Pakistan. It was a pilot study that we have done. So here's the introduction. So the situation in this region is changing fast, and this situation creating the cities more crowded and increases the demand for inexpensive and ready-to-eat foods. So in this case, the street food is becoming more popular, and this raises the concern of safety food environment in the region. So therefore, we conducted a pilot study in urban slum area, and just to see how the quality and how the food environment is in this region, in this area. So we conducted this study in the east of Karachi, that is a part of Sindh province, as you can see, and Karachi city. And this is the Azam Basti is in the center of the city, east part of Karachi. We conducted in this study, we had 4 themes. So first one was geomapping, where we did the types of vendors, and we also noted down the location of each vendor. Then we had food vendor survey, where we analyzed the chemical analysis. We did the chemical analysis for the nutrient content, and also observed the food quality. And we observed all the food available with the food vendors. Then we conducted a household survey, where we found out the prevalence of the NCDs in the urban slum area, and also did the dietary intake survey. We also got the household costs associated with buying food from the different sources of this population. And then in the last, we did the qualitative study, where we found out the drivers of the food choices. And we did try to find out the food recipes and the process of generating them, and then the food business practices by food vendors and the staff details and the food chain supply. So here's the first theme, that is the quality of, we checked the quality of the food items. As you can see, the results of the chemical analysis, 21 out of 34 food items had high content of fat. And then in trans fat also, the 10 out of 34 food items had high trans fat content on those food items available with the food vendors. Then sugar was also 8 out of 13 had high sugar content in the food items, and salt 9 out of 21 had high food content, salt in their food items. You can see the pictures, and you can see that single item had multiple nutrient content that is higher than the recommended amount. So here's the food vendors survey results. All food vendors in this area are male, and the education status is around, they pass grade 10. 31% only had grade 10 education. Then they had no formal training and no country formal training there for them, but they were 33% had informal training from their experienced colleagues who teach them the basic techniques. Then these informal training included some food handling and food safety, food preparation, and quality assurance practices. The business-related key points are that they inherit the business, majority of them, and the majority of them also inherit the recipes of these food items. Some hired cook got their own recipe when they joined the business. Findings of the food household survey. So monthly income of this population is around $175. They spend $37 on average on the food. And out of this budget, they spend around $12, which is around 32% of their total monthly expenditure on the food items that they purchase from the food vendors. The BMI we found of this population, as you can see, that 29% are overweight and 42% are obese population in this area. The prevalence of so nutrient intake, we also did 24-hour recall, and we found a daily intake of the nutrients. In the interest of time, I'll just skim through these. I pass the details. I go to the prevalence of NCD in Azam Basti. So as you can see that the diabetes prevalence is around 10%, high blood pressure is 20%, heart-related condition is 4%, and cancer is 0.2%. We also conducted the qualitative part where we did the in-depth interviews with the residents. The common themes that we found from this survey is that they found that these eating out and having food from the vendors is quite trendy and fashionable, and is very popular in the young generation. Then they prefer the food items from the vendors because of the good taste. They know that we have observed that the inflammation has reduced the buying power, and that they have also mentioned that they are not they have decreased their getting food from the vendors only because they are getting expensive. Awareness of the health concerns with these food items, is there. They know the quality, but they still prefer the taste over, these health conditions or health risk associated with the food available at the vendors. Their willingness is there to change or to learn, and this is they are happy to understand what they can do to change these habits. So the results of the in-depth interviews that we conducted with food vendors, the common themes included high inflammation reduces the quality of the food items, as the vendors cannot afford good quality ingredients anymore. High inflammation, as it reduces the buying power, also affected their business, and they are very much concerned about it also, because if they increase the prices, then the purchase goes down. The rule changed recipe modifications. They are doing the modification with time, but this is basically based on the feedback they get from the customers. The raw ingredients, they mostly purchase from the wholesale markets. They are available, not in the package. They are open ingredients from where they purchase, and because these are cheaper than the quality product that are available with packaging. Vendors know good quality is important, but also they can't afford to increase the prices immensely, because it will then affect their business. There is a demand and supply situation. Obviously, if they are happy, if the customer is happy with the quality, they are happy to sell the same food. So what's next after this survey? Now we wanted to go a larger way. We want to conduct large scale surveys to see, other areas, to cover other areas, slum areas and urban areas also. We need to develop a consensus with the vendors to modify their recipe and make them healthier. We also need to do some awareness campaign about, such as food labeling for the customers to understand how bad the food is which they are buying. Last but not least, the policy advocacy that we would like to do, and we need to involve our other stakeholders, including the policymakers, to understand how big this problem is, and we need to monitor the food available with the vendors. Thank you everyone for listening. I acknowledge all my team members for this project. Thank you.
Thank you, Amber. Thank you. The floor is open for questions. If there are any questions for the three presenters. I know that some of you have written questions in the chat box and Lola has responded to them. But if there are any other, please raise your hand and we'll take your questions, and then we'll move to the second very important bit of the session, which is how to work together in this area in the future. All right, so I'm not seeing any questions. Perhaps you can continue to type in the chat box, and our three speakers and I will be happy to respond to them. I'll hand over the chairship to Lola to talk about next steps. Lola, over to you.
Hi, so hopefully after hearing, so we've really started only just exploring this area. So Romana and I have had this large project which has been looking at health in slums, but specifically healthcare use in slums. But through that project, we've realised that we've got a mutual interest in diet-related ill health, and that's what we want to explore next. And we have understood from the unit's work so far, and from particularly the community engagement work and the slums sites that we've worked, that there are lots of concerns about diet-related ill health. So people talk a lot about diabetes and hypertension as being worries to them and their family. And so that is really the driver behind wanting to do some more of this work, and hopefully some of you would be interested too. So really at this point, we just wanted to hear from you what we thought next steps might be. We'd be interested in, for example, forming a special interest group. If so, what platforms might work best? How could we communicate? And then thinking about the first things that we could do as a special interest group, we might want to look for small opportunities like networking grants to bring us together. We might want to look for larger opportunities to actually write substantial research grants together. And then potentially, while waiting for those opportunities to come along, could we be thinking about writing something together? And if so, when might we want to focus on that? Where might we want to aim? So just really interested to know if anybody's got any thoughts or interest in collaborating on this sort of work going forwards, or if anybody has any experience of doing work that's relevant to this area. So if anybody has experience of looking at food behaviour, the food environment, food-related ill health in deprived urban neighbourhoods, it would be really good to hear about the kind of things you're doing. Helen, was it that you mentioned you had a PhD student who was potentially going to work in this area?
Thank you so very much. I've enjoyed the section. I'm from Nigeria, and my PhD work is actually on school system, secondary school, food safety among secondary school students, the adolescents. So we're actually looking at the understanding the practices and the knowledge of food handlers that prepares food in those schools, and the consumer, the behavior of the students. And it's ongoing, and the findings is, the trend of the finding is like, we need to do a lot of awareness on food safety practices among adolescents and how to improve their healthy food habits. A lot of things, a lot of them take soda drinks. They do not really like better or homemade food. They take a lot of biscuits, dry foods, just sweets. And as I agree with you, the diabetes, everything is actually increasing. Maybe we need to also include a campaign, you know, among, maybe school curriculum can also do something about that. If there's something in the school curriculum to help students understand making choices, the food options, and making the school environment also a venue to make safe food available. Maybe there should be vegetable and fruit stand in the school rather than all this over-processed junk food that is always available to the student. I think we can come up with something like that that will help the student in making better choices. The parents, when they come around to pick their students, can get access to buy something home that is healthier and better for the family. Thank you.
Thank you. No, it's really good to hear about what you're doing. And I think that that's definitely an area to think about the school environment as a place to definitely capture a whole segment of the population. Thank you very much. And I can see that Isatu Jallo, you've got your hand up. I wonder, would you like to speak?
Yes, thank you so much. I'm just so happy that I chose to participate in this session because I learned so much today. I loved all the presentations. And I was especially intrigued by the idea of using photo diaries among adolescents. And for me, I would love to do that here in the Gambia and elsewhere on the continent. And not only among those who live in the slum areas, but in the urban areas in general. Because as nutritionists, we have neglected the urban areas and the peri-urban areas. Our focus has been on rural areas, and rightly so. But there is so much going on in the urban areas and the peri-urban areas. And also the idea of talking to food vendors, because most of our population, they get their daily meals from street foods. So we need to work with food vendors, and especially in the schools, because during the break, most children, whether they have school meals inside or not, they go out, they have money, and they go out and they buy food from the food vendors. So I'm very much interested to be part of this. By the way, I'm the executive director of AFRICAN, which is Africa Catalyzing Action for Nutrition. And we're targeting all the AU member states. And we're not implementing, we're catalyzing action. So this is fantastic. Thank you all so much. And I've learned so much. And yes, I would love to be part of this. Thank you.
That's wonderful to hear. I mean, I think that already we're starting to hear about different places to intervene. So the schools, for example, but I think, yes, the food vendors, especially when we're considering that people don't have the space or resources to cook at home, then people are buying ready to eat food on the street. And so actually, in a way, it's a very nice place to intervene, a very nice way of influencing lots of households at once if we can work with people to redevelop recipes and reduce the amount of salt, certainly reduce the amount of trans fat in some of those products. So that's great. We'll definitely reach out to you again as we go forward. Anybody else got relevant work to share or perspectives on what we've talked about? Oh, we've got a question in the chat. Sorry, I haven't noticed the chat at the same time. So please, what is the best way to control the quality of food from food vendors? I mean, I definitely don't know the answer to that. I don't know if you want to start, Umber, with some thoughts from your work with the food vendors.
Thank you, Dr. Lola. I think the answer is that we need to explore. We need to have a consensus building meetings with the vendors. We need to come up with the options, the healthier options, where we can find out what is the way to go, and without losing the customers. As we have found out that customers do prefer taste over healthy food items. So we need to develop a consensus. We need to develop, we need to engage community. We need to make them understand how important this is and how the NCDs are, and the numbers are going higher every year in this region.
Thank you. And Isatu, do you have something to add to the same discussion?
Yes, I believe it is always easier to start with what already exists. What are these food vendors preparing that is so appreciated by their customers? And start from there, rather than bringing in new recipes of what we think are the nutritious foods or what we know are the nutritious foods. Let's start with what already exists and see how we can add on to that. And it's not just about the food quality, it's the food quality and the food safety. And education and collaborating with the food vendors is key, as well as educating the customers, because we need to work with both sides of the coin, food vendors and the customers, and education is key as well as collaboration with them. Thank you.
Thank you. I think that's really good to know. I mean, I think one other thing that we've learned from the UK is that because of various legislation, we have reduced the salt in a lot of processed food that's eaten in the UK gradually, year on year for decades, and that actually people's tastes do adjust. So I mean, I think even that kind of thing, to start with dishes that are very popular but might be maybe high in salt, and I guess to be very reassuring that actually if you reduce the salt a small amount, people don't even notice it. And you can do that gradually over time, and people's tastes will shift with your product. So that could be something that would be useful for vendors to know, that they can be offering something that's healthier without the consumer noticing it. And I think, yeah, thinking about that sort of taste testing could be good too. Oh yes, I was wondering, how do we really make healthy food tasty, or that people perceive them as tasty from Aditi Roy? No, I mean, again, yes, I mean, tying into that sort of idea that people's tastes might shift. I mean, there was nobody's here from UCL, are they? But UCL did some very interesting work, again, showing how people's tastes can change, and that, you know, repeated exposure to something, most people will end up enjoying that food. So just thinking about, yes, trying to shift people towards finding the healthiest food, the tastiest food, and making the decisions because it is tastiest to them. I think that's a very good question. Anybody else got any answers to that question? How do we make healthy food tasty? Well,
can I add, Dr. Lola? I just believe that if you run a successful campaign against anything that you feel that is not, if you educate people and you make them realize that this is on a long term, it's not going to help with other conditions that we are being are there in the society. I feel that as the smoking campaigns all over the world has worked. The numbers are coming down. So I believe that if we have vigorous and big campaigns, media campaigns, and through literature, we make them realize that this is something that we need to modify our lifestyle. Instead of going for food that are high in the content that is dangerous for you or bad for health. I believe that the shifting of their thinking, going for tasty food to healthy food is important, instead of making the food according to that taste. That's what I believe.
I mean, I suppose with smoking, there are lots and lots of interventions that have come together to reduce smoking prevalence, one of which is education, but tax is probably one of the most crucial parts of that the WHO Framework Convention of Tobacco Control saying set 70% of the price as tax, and making it actually unaffordable for people to smoke has had a large part in reducing prevalence. So I think there are lots of angles, but education being one of them. So, I mean, people have started sharing their email addresses in the chat. I'm thinking about the next steps then. If you would be interested in writing something together, it'd be great to hear from you. So I'll also put my email address in the chat. I think Romana and I will start to think about writing something together over the next 6 months or so. And if people were interested in joining in with us on that, then it'd be really good to hear from you. And then going forward from that, I think the next thing is that we would be starting to look for either the smaller networking type grants or the larger grants that would allow us to build on what we've done so far and go further. So it'd be really, really good to again, hear from people who'd be willing to collaborate that way. And I think at this point, maybe the best thing is to reach out by email. If people wanted to jump in and say if there are other forums that you use that you think would be good, it'd be really good to hear from you, but everybody's a little bit quiet. So at this point then, Romana, with sort of 4 minutes to go, anything else that you would want to bring in?
Thank you, Lola. So I've noted down emails of everybody who has put them in the chat box. So I think the next thing that we'll do is send a formal note to all and then take things forward from there. I think that's all what I'd like to say for now. So back to you, Lola.
Thank you. I mean, I think if that's the case, then it would probably be good to, we'll leave up the chat for another minute or so. So Elena, if we could keep the event open for another minute in case people wanting to write their contact details in the chat. But otherwise, I think we could close the session for today. And just to say, thank you very much for joining. Thank you for your contributions and your questions in the chat. And it's been really good to meet so many people who are interested in this area. Thank you and goodbye.
Yes, bye for now. Thank you.
Thank you so much to our session organizers. This was a great session.